Hey everyone, it's Neil Bhavsar with Medscape Medical Students. This time on Resource Review, we'll be talking about a few Medscape reports. Again, I'm an intern for Medscape, and I do have extra exposure to Medscape resources. With that in mind, I just want to say that these resources are helpful, and I'm doing this in a very neutral and modest way, and I hope that you find them helpful as well. So the first thing we're looking at is the Medscape compensation report. This year we had a compensation report for 2018 come out. Medscape does this annually. Let's take a look at it. Let's see how it helps out with school and if it might be something you want to use on your day-to-day. Okay, so the first thing you want to do, again, head on to Google on any browser you're choosing. Go to the search bar and search up Medscape compensation report. And the first thing you should see is the most up-to-date compensation report being the first search. Click that link. And there we go. We're looking at the Medscape Physician Compensation Report for the year of 2018. Being a little bit more information on it, the Medscape Compensation Report for 2018 covers over 20,000 different physicians from the US, as well as 29 different specialties. So that's pretty comprehensive. It is probably the most comprehensive compensation report from physicians out there on the internet today. And I personally like to look at it not just for a little inspiration, but also because it provides some great questions about the physician lifestyle and questions that surround really compensation in the medical world. So let's get to it. All right, so as you're making way throughout the report, the first thing you'll probably see right here is the average annual physician compensation by specialty. You'll see a list of numbers starting from plastic surgery that they make $500,000 per year, all the way down to public health and preventive medicine. There are a lot of different numbers here. There's a lot to take in. It's usually good for talking points when we're meeting with different specialists to understand their lifestyle and what they're kind of sacrificing for large salaries, because everything has give and takes. So it's definitely a good talking point, not really the salary, but what comes from it and what's done to balance it. So another interesting thing on the compensation report right over here is the physician compensation by geographic area. If you're thinking about where you might want to live in the future, or where you are currently and where you want to do residency, or where you want to specialize, it's just something interesting to think about. Not that you're making any commitments today in medical school, but also it's just inspiring, it provides some hope, and it's just exciting to look at. So right here, we're looking at which physicians feel fairly compensated. I personally like using this as a tool to understand the heuristics that each specialty kind of takes when it comes to their field. It allows me to ask certain questions as to, do you feel fairly compensated? Do you feel appreciated? Do you feel like the work that you're doing is valuable to the community that you're helping? And you can take this survey and just look at the different specialties, see the numbers, and kind of match it up with local physicians that you have access to that will answer your questions, any mentors that you might have. Another thing that I thought was really interesting was the what is the most rewarding part of your job slide. It kind of broke down different reasons why people became physicians in the first place. And it's good to know that some people have very noble reasons for staying in the field, ranging from gratitude to relationships with patients, all the way to being proud of being a physician. These are things that kind of keep you inspired and hopeful for the future, but at the same time, it's just interesting to look at. So, which physicians feel fairly compensated? For me personally, I'm kind of leaning towards emergency medicine or general surgery right now. I really don't know. Again, I'm just a second-year student. I haven't really seen the clinical side of the medicine to make my decision. But when I look at these charts, it kind of reassures me. Emergency medicine physicians feel the most fairly compensated out of the other specialties that were surveyed. If you look at right over here, if you would choose medicine again, emergency medicine is around 82%, which means that 4 out of 5 physicians would pick the same specialty again. Now, this doesn't mean that these are bona fide points that I will use to make my decisions in the future, but these are good talking points that I can have when I shadow EM physicians at my hospital and see, hey, do you feel fairly compensated? Would you choose medicine again? Why or why not? Here, you have the start of a conversation. You have questions that you might want to ask, but you can continue that conversation with your mentors around your hospital or around your local area. So these were kind of the main talking points that I thought were relevant from the compensation report. Definitely check it out, find your own. If you are interested in seeing other reports, just check out the medscape.com/features reports at the screen, the link you see here on the screen. And there's reports on burnout, reports on wealth and debt, reports on resident salaries and the best and worst place of practice, which we may cover in the future, but definitely feel free to check them out right now. Again, my name is Neil Bhavsar. This is a resource review, and I personally would put the compensation report in honors on the fail, pass, high pass, and honor scale that we use here at Resource Review, just because it keeps you motivated on the aspects that you care about. Are there physicians who have been tenured but are still really motivated to help patients? Are there physicians who have reached a certain level in their career where they're still happy to pick medicine again? The compensation report does delineate how much a salary would be, and that's definitely exciting, especially when you look at how much debt we're in just by doing first-year medical school, and there's 3 more left. But I'd like to say that there's a lot more here than just money, and it's really talking about the type of physician you want to become, and it gives you great talking points that you can use in your classes, in your clinical rotations, or in your shadowing experiences with physicians. So again, this is Neil Bhavsar on Research Review. See you next time.